Welcome to the EpiCore training course. This course will explain key concepts of EpiCore and provide you with step-by-step instructions on how to use the EpiCore system. By the end of this training, you should feel comfortable using EpiCore and applying your knowledge and expertise to this innovative global surveillance system. Upon completion of this course, you will be able to describe what EpiCore is and how ProMed is related to EpiCore. Explain why you should become an EpiCore member and what you'll gain from it. Describe a request for information and explain how to respond to one, and describe how to use EpiCore. So what is EpiCore? EpiCore is a new system that finds and reports outbreaks faster than traditional disease surveillance methods alone. EpiCore draws on the knowledge of a global community of human, animal, and environmental health professionals to verify information on disease outbreaks in their geographic regions and connects them with a secure online networking and reporting system. By using innovative surveillance techniques and linking local and international health experts, EpiCore enables faster global outbreak detection and reporting. EpiCore was created as a partnership between the Skull Global Threats Fund, ProMed Mail, HealthMap, and TefiNet. Communication on EpiCore is facilitated by what are called Requests for Information, or RFIs for short. Experts at ProMed Mail, which we introduced in the first module, look for leads regarding possible outbreaks around the world. When evidence of outbreaks is found, ProMed Mail experts send an RFI to request verification from EpiCore members in that geographic region. Through a secure online platform, members are able to easily and quickly provide local expertise, which speeds outbreak verification. The information collected through EpiCore is then shared on ProMed Mail, which is a free, non-political system that has an open and public worldwide distribution. We'll talk more about RFIs and ProMed later in this module. EpiCore members must have certain credentials. These include a degree in the human or animal health fields, which could be human or veterinary medicine, nursing, microbiology, or a similarly relevant field, plus a knowledge of the basic principles of epidemiology, infectious disease, and/or related fields. All EpiCore members must have at least 2 of the following qualifications. Okay, you're interested in EpiCore, but you might be wondering, why should you become an active EpiCore member? Let us start by mentioning that only qualified and experienced health professionals are selected. As a member, you will be part of an exclusive and elite cohort. The benefits of participating are numerous and vary in magnitude by country and region. For example, for some countries that do not have a comprehensive disease surveillance system in place, EpiCore helps health professionals in one area or sector to be aware of any outbreaks in other areas or sectors of the country. Additionally, some countries do not regularly or consistently share surveillance information with neighboring countries due to linguistic, cultural, or even political barriers which do not stop pathogens from crossing borders. EpiCore helps health officials and professionals in these countries learn about potential outbreaks in nearby locations. This information can help them initiate life-saving prevention and control measures. In our globalized world, It can even be beneficial to know about outbreaks thousands of miles away, so health officials around the world can appropriately prepare to receive travelers from affected countries and monitor new cases. It will also help you, as an EpiCore member, to make sure that correct information about potential outbreaks in your country is shared with the rest of the world. If, for example, you receive a request that you know is based on a false rumor or simply has inaccurate or irrelevant information, you can help make sure that the correct information is being disseminated. The key is that increased reporting improves our knowledge of what is going on around us. This helps us all to be more prepared. In our modern world, infectious diseases can travel fast. EpiCore members can help protect people in their communities, countries, regions, and across the globe. Your participation in EpiCore will be critical in helping to prevent or even stop epidemics and save lives. By becoming an EpiCore member, you will help change the landscape of disease surveillance. All EpiCore asks from its members in return is simply your knowledge and a very small amount of your time. EpiCore truly embodies a small commitment, big impact approach. Previously, we mentioned the requests for information, or RFIs, that will be sent via the EpiCore system to members. Next, we will explain where RFIs come from and the purpose they serve as part of EpiCore. As we mentioned earlier, RFIs are sent by a group of experts from ProMed Mail. These experts are carefully selected infectious disease specialists based around the world. They are trained to recognize possible outbreaks of public health significance. They continuously monitor non-traditional information sources and publish reports on emerging and re-emerging diseases from all over the world. ProMed Mail, or simply ProMed, is an internet-based reporting system that is dedicated to the rapid, global dissemination of information on infectious diseases outbreaks and acute exposures to toxins that affect human health, including those in plants and animals that are grown for human consumption. ProMed's reports are published online and include expert commentary. These reports are accessible on the ProMed website and are sent by email to its continually growing list of 80,000 subscribers. ProMed operates 7 days a week, is free of charge, open to the public, and is non-political. Here you'll see some of the posts on ProMed. Pause the video here to explore the ProMed website and, while on the site, try to find a post about your country or a neighboring country. Then continue when you are ready. Here is a link you can use to know more about moderators. Did you find a report about your country or a neighboring country? Now imagine a similar post on a possible outbreak in your country or region. Only it is missing vital information or simply has incorrect information. This is when you get a chance to verify outbreak information in your location. To summarize, RFIs are the method of communication used by EpiCore and are sent to EpiCore members by the ProMed moderators. You can respond to any RFI you receive to correct or fill gaps in missing vital information, or to verify outbreak information received from an informal source. The information or verification you are able to provide means that more accurate news of this potential outbreak will reach those who need it more quickly and could help the affected area avoid an epidemic. Please pause the presentation here to answer the following question. Then continue when you are ready. You may be wondering by now what type of information you should provide in an RFI response. Here are some examples of the types of information that can be used in an RFI response. Information on person, such as demographics, age, gender, etc. Case numbers, fatalities, lab results, diagnosis, pathogens, supporting information. Information on place, such as the location of patients. And information on time, such as the date of occurrences. Remember, some information is better than no information. You might already know the information you want to use in your response, but you may also decide to gather or reinforce your information by phoning a friend or a colleague, checking local media like newspapers, radio, and TV, checking social media in your language for any trends on the disease or symptoms, checking official reports, going back to the original source, calling a local hospital, clinic, or health center. There is only one more section left before you complete your training to be a certified EpiCore member. Next, we're going to show you how to use EpiCore's online platform. The first thing we wanted to point out is that you can always edit your EpiCore personal profile by clicking the Edit Profile tab here. This feature will enable you to change any of the information you submitted on your original EpiCore application, including the email address where you prefer to receive EpiCore communication, the country of residence, your education, and work information. As soon as you become a certified EpiCore member, you'll start receiving RFIs via email. To ensure that our emails make it to your inbox and are not filtered into your junk or bulk folder, please add no-reply@epicore.org to your list of trusted senders. Here is an example of an email sending you an RFI. To respond, click on Respond. Note that no reply at epicore.org is a no-reply email. As such, if you attempt to reply to the email directly, your email will not be delivered to the moderator. Then, click on Continue to EpiCore. You will be directed to the response page for that RFI on the EpiCore website, where you will see the text box ready for you to type in your response. There is also an option of going to EpiCore's website directly to view and respond to the RFI separate from the email link. Go to www.epicore.org. Once you log into the EpiCore website, you will be directed to your dashboard, which will look like this, where you will see all of the open RFIs you have received listed here. It is important to note that RFIs can vary in content. They could be long or short, depending on the amount of information the moderator has on the rumored outbreak. So the RFI could look like anything between a full ProMed post to a simple one-sentence question. This is an example of an RFI that includes a full ProMed post with a specific question. This type of RFI provides all the information the moderator could find on the rumored outbreak, including the source of the information and a list of any other similar outbreaks in the country or region. This is an example of an RFI with a simple question from the moderator. This type of RFI would not typically have ample information on the source of the rumored outbreak. For example, I heard from a colleague in your country that there is an E. coli outbreak in Jharkhand. Can you confirm this outbreak? Let's go ahead and respond to one of those RFIs. A few minutes ago, we discussed how you can respond to an RFI by clicking on the link on your email. We also mentioned that you can also respond to an RFI directly from your EpiCore dashboard. To do so, click on the RFI you would like to respond to. Once you click on the RFI, you'll be asked if you have any information to contribute regarding the suspected outbreak. If you do have information on an outbreak, click on Yes, Respond to this RFI. You'll be directed to a page with a text box in which you can type your response. This is the same page you would have been directed to if you clicked on the email link to respond. When you respond, your identity is always hidden, so moderators will not know who you are unless you choose to reveal that information in the text of your response. After filling out your response, you will then need to select your preferred confidentiality setting. We have created options here to help you communicate to the moderator the level of confidentiality you prefer. You can choose to ask the moderator to directly quote your response and attribute it to you when including it in the public ProMed post. If you choose this option, you will be prompted to enter your name and title as you would like them to appear in a public post, since they would not be revealed to the moderator in any other way. This option is marked with a green circle on this page. If you want to give the moderator permission to quote your response, but would like them to mask any identifying information referenced in the response text, or any details you might provide on your identity, you would choose this option. This option is marked with a yellow circle on the site. It is advisable that you point out any information you want them to mask. Or, you can request that the moderator paraphrase your response entirely to avoid using any words or phrases that can inadvertently help reveal your identity to the readers. This option is marked with the red circle on the site. It is important to note that even if you wish to remain anonymous, ideally, you will still share your name, title, and place of work so that the moderator puts your response in perspective and knows that the information provided is credible before disseminating it, just as any good journalist would do. Moderators are trained to keep your identity confidential, and you can always request confidentiality by choosing the red or yellow permission levels. However, it is completely up to you to decide the level of information you are comfortable disclosing in each response. After all fields have been completed and your preferred settings are selected, click on Submit. The EpiCore website is built to protect your anonymity. You will also need to safeguard your own privacy, if it is of concern to you, by making sure that you are not being monitored while submitting a response, and by closing all other pages on your browser, as some social media pages, if opened simultaneously with EpiCore, might jeopardize anonymity. After clicking Submit, you will be directed to another page where a verification box appears stating that your response has been sent to the moderator who initiated the RFI. Always remember when responding to an RFI that some information is better than no information. However, if you do not have any information at that time, simply click on No, Not at this time. When you click on this button, a message appears on the moderator's dashboard that a member indicated that they do not have any information to contribute at this time. If you come upon new information to contribute to an RFI after you have clicked No, Not at this time, you can always go back and contribute to the RFI in the future. Any messaging history for the RFI will be listed on its page as shown here. It is important to note that you will only receive an RFI if an outbreak is suspected in your country or region. This means that you might not receive an RFI for weeks, or you may receive several in the span of a few days. When a moderator sends an RFI to members within a certain geographic area, he or she will assess all the responses received, and if sufficient information was provided, the moderator might decide to close the RFI. This will move that RFI from the Open Events tab on your dashboard to the Closed Events tab. But note that you will still have the ability to respond to RFIs even after they are closed. And this is because we recognize that you might come upon information on an outbreak you think is important to communicate after the moderator closes it. After the moderator receives your response, he or she will assess it, along with any other responses received, and they will then use the compiled information in a post published online on ProMed Mail's webpage and sent to its subscribers. See, it's really that simple. Your verification of an RFI will help you and the rest of the world detect outbreaks faster by verifying potential outbreak signals. By detecting outbreaks faster, health officials can generate early responses that can curb epidemics and save lives. Think about what a difference it could have made if we had known about the Ebola or MERS outbreaks a few weeks earlier. This is how you and EpiCore are changing the landscape of outbreak detection and reporting. We can't wait to start working with you. We're happy to answer any questions you may have. Please send any questions to info@epicore.org.